Thanks, Niall and Dermot and everybody for inviting me along to this. And obviously I represent a bigger group really of public health doctors who are involved in climate change work at the moment. And so I'll just move on with this. I suppose the things I'm going to talk about here they've been touched on pretty much by everybody else as well, but I feel that the thing that John hears enough from me anyway is about interdependencies, because I suppose we're all coming from working in separate areas and is trying to communicate clearly our messages across to each other in all the other sectors, because we all have to influence each other and we have to try and learn from each other and help each other in a way to get to a better goal in the long run. I'll talk a little bit about it at international level, though I'm not very involved in that, but just what I see there. And then, of course, Ireland and what we're doing in Ireland about climate change and health in Ireland, and some of the work that our Environment and Health Group is doing at the moment, with contributions from even people outside of that and some of our other public health colleagues. And then some of the challenges and opportunities. I'll keep them brief, but actually I think they've been mentioned before. Climate change and health, when I was thinking about this, I was thinking, where does health fit in there? I mean, we obviously think it's really important because most of us are working in a health area and we value it a lot. But I just put in our health definition from the WHO from 1948, and it's still the main definition, really. Other people challenge it sometimes because they say it should be looked at from a different way, but it's a very, very all-encompassing definition: physical, mental and social well-being, and not merely the absence of disease or infirmity. So it's something that is really important to everybody in the world, and no matter who they are. And I think that we know health is valued. I mean, Galway today here, we speak Irish sometimes down here, but anyway, it's Fear an Sláinte na Táinte, which means health is better than wealth. And I think that's an international saying as well. And of course, prevention is the best cure. So these are very famous sort of phrases that are used, and they're sort of seen as truisms, I think. So I think we know that health is valued, but sometimes it doesn't get onto the agenda, same as children don't get onto the agenda. Sometimes if we don't really push it, it doesn't be seen as being an issue. Obviously, our interdependencies are everywhere. These are not my slides. I took them from Google Images, and I can't really see who I can. I hope they'll forgive me anyway. Whoever drew them up, I think they're CDC and people like that. I'm sure they're happy enough with me putting up some of their images. But anyway, the interdependencies for climate change control, if we could ever get control of it, I know that's a very big challenge. They're obviously global, national and local, and of course the decisions that get made are made at local level. And as Nick talked about the political will, it's down to the elected representatives with their local populations telling them what they want, and that's very challenging. And yet the whole world depends upon all these local decisions being made. Mitigation obviously requires action at all levels and needs to be coordinated, and it needs to be comprehensive to be effective, and we all know that. Our health interdependencies, we obviously depend upon mitigation to limit these impacts. We can see them coming down the line. We can see them probably happening already. And, the health sector can't fix this. The health sector can contribute a little bit, but obviously we're depending on the whole global, management really on how we're going to affect change there. We depend on many other sectors, and many of the health impacts of climate change, they're outside of the control of the health sector or even the influence of the health sector. And so that's where maybe these interdependencies come in. We need to try and start communicating and sharing information. And even being understood, I think that might be something that we maybe aren't always understood as well as we think we are. We can have health impacts that could arise from other sectors' plans. Even the best laid plans may turn out to have unintended consequences or maladaptation. So we're going to have to be very clear communicators on how to achieve the best quality adaptation and mitigation as well. As John has mentioned about the Climate Action and Low Carbon Development Act, this is actually giving us a statutory framework for pushing forward, which is really helpful in a way because it, I suppose it's an iterative process. Nobody knows everything. We all have got to learn more, but having a statutory framework pushes us to try and achieve better and quicker, maybe. The National Mitigation Plan is already sort of being developed, and the adaptation framework as well is nearing finalisation. And these have required a lot of coordination and working together. And again, they may not be perfect. We may not have done all of the coordination and working together that's required, but it's getting there as well. And I suppose really we feel that health is likely to be impacted by other people's plans for mitigation and adaptation. but hopefully for the better. But we've got to make sure that that's the case as much as possible. Now, this is a really busy slide, as Nick mentioned. It's just my effort at really just locally mapping out the sort of climate impacts on the left-hand side, or the really weather impacts. With the middle ones are the environmental effects, like all the things that happen in Ireland, like our disrupted power supplies, communications, water supplies and so on, sanitation, flooding, unsafe roads, buildings and other infrastructure and so on. We can have loss of habitable land, drought. It can happen in Ireland even with the precipitation issues that we have. Then the changed environmental fate of zoonotic pathogens and vectors. I mean, that's something that could have big game-changing effects, and yet, it's an area in which we need more science, really, I think. Same with the transport of those organisms that survive longer. A lot of our assumptions in protection of human health through the environment are based on science that says, like, the die-off period of organisms and so on. Those things may be changing. And again, increased UV exposure opportunities. Well, most people in Ireland welcome that, but we still have to be careful about our skin because most of us aren't probably adapted for it. Indoor and outdoor temperatures, air quality issues, and respiratory allergens. They're the sorts of things that we're putting in. They're not all inclusive, but they're the sorts of things that we're thinking about at the moment. And I think I've broken it down into more detail there. Just, again, I think some of the biggest issues there, the basic things like unmet basic human needs, including water, food and shelter. And I know we see that more so maybe in countries that are struggling more with development, but those are things that are happening in Ireland too and will happen perhaps more. And we depend so much for our healthcare on communications, power, water, supplies and so forth. We have emergency systems could be challenged, and of course mental health effects. John mentioned that. Are we measuring it? These are all challenges for us really at the moment. We can expect them to be significant for isolation, displacement, physical, emotional, and economic losses, stresses, and losses. And physical injury, drowning, and infectious diseases are all the things that we're expecting. Again, the same thing here, and more, from rising sea level, changes in precipitation, warmer weather and so on. We expect more challenges in Ireland as well. Obviously we expect a little bit decreased cold-related mortality. That could be one of the opportunities, but most of the things we're concerned about are worsening health issues. Now, our stakeholders include, obviously, other parts of the health sector. We have a massive health sector in Ireland with, we say, 100,000 or so workers, and most of us don't communicate with each other because we don't have that opportunity, really, or it isn't set up for understanding everybody's role completely. Department of Public Expenditure and Reform, the OPW, all of these within Ireland are important stakeholders. Energy and communications, agriculture, environment, including the local authorities and EPA, transport, then the water services and sanitation as well. So far, our responses have been really working with the Department of Health and just, making ourselves more aware, really, of the policy and planning framework and trying to gear ourselves up so that we can start responding and providing what we need into health sector planning. Part of that is ensuring the health infrastructure is climate resilient. We've had issues in the past in which hospitals have been flooded and so forth, and you can't afford to have that sort of thing happening if we can avoid it. But of course, something that I'm aware of is the dependencies. Our health infrastructure we know what our health infrastructure is most of the time, but our infrastructure can depend upon other people's infrastructure in the private sector or so forth. And so we have to be thinking about those dependencies as well, and who depends upon us too. Planning and preparing for severe weather, that has been happening in the HSE, and it's been quite comprehensive in lots of ways, and it's starting to mainstream, but obviously we need to keep pressure on those things to make sure that they are rolling out everywhere. And obviously our emergency response services and public health medicine and trauma, all of those, we all need to be geared up and ready for actions that might be required. Climate epidemiology, I think it's a new word, sort of, but it's obviously anyone who's working in this area will think of it as being an epidemiology that does need to be there. For anyone who doesn't know, epidemiology is really the study of the causes and distribution of diseases, and obviously we're trying to learn how to describe the diseases associated directly or indirectly with climate change or weather. And then, of course, health advocacy is an area in which we always need to be working in and trying to communicate with others about the issues that we have. Part of this that we've been doing is through bodies that we already have. The Faculty of Public Health Medicine asked us to deliver a paper on climate change adaptation and health. And so through that, we produce some of the work that we have on that. These things are probably iterative again. We probably need to improve them as time goes on. We need to learn more about other sectors and how we can, make better recommendations. But so far, really, it's about doing what we're already doing in a way, developing climate policy and a strategy for the health sector, developing these plans. And I suppose something within public health particularly is we need to develop appropriate surveillance and investigation systems so that we understand our vulnerabilities better and be able to monitor health associated with that. And that paper has been endorsed by the Royal College of Physicians of Ireland. But again, I'm sure it needs to be looked at and kept up to date as well. Another one we did was in relation to the Citizens' Assembly. We developed a paper for really just, I suppose, a brief paper just to say, look, health, make sure health is on the agenda here. And we gave a summary of some of the issues that we see. I have to thank Matt Robinson, who really gave us a spur for that. He's one of our specialist registrars in public health medicine. And it was, again, it's an area in which we probably need to improve our position on this, but it does capture some of the points really that Ireland has a lot of work to do in relation to mitigation, and we have some data from the EPA on main emission sources, and reducing greenhouse gas emissions may be challenging, we feel, but there are numerous health co-benefits if we could tackle this as soon as possible. But of course, from a health point of view, we need to also make sure that the transition policies are acceptable to people, that they protect the health and well-being of the people in sectors affected, because you can't really have intolerable burdens. So they need to be incentivised and supported, and we need to understand what the challenges are for everybody who has to bear burdens. Like for instance, I mean, we would obviously like the agricultural sector to go more from animal-based to plant-based in order to reduce emissions. And they're not just air quality emissions and climate, or greenhouse gases, but also environmental microbiological contamination is associated probably with some of the animal-based agriculture as well. And with our hydrogeological groundwater vulnerability in Ireland and increased rainfall that we're expecting, that's going to be something that's going to be harder to manage. So these are things that we'd like to put on the agenda really as well. Same with in the transport sector. Obviously, we're recommending that we move from passive transport, to more active travel, encouraging, which will obviously improve both air pollution, or reducing air pollution, but also have massive human health benefits from reducing obesity, increasing, fitness and so forth, and helping to control a lot of the chronic diseases that we have at the moment. And obviously, improvements in that area will reduce the burden of chronic diseases on the health services that are very overstretched. In the energy, residential and manufacturing sectors, obviously we're again looking for them to go from more carbon heavy to carbon lighter energy sources and so on. And we feel that we can get more significant benefits of that. Now in the health sector, the WHO has produced advice on that, and they've got about 10 different actions in which we feel that those sorts of actions within the health sector need to be pushed as well. And I think you can all read, well, I don't know if you can read that or not, but really, they're pretty obvious, like managing our own waste and hazardous chemicals, promoting efficient management of resources and sustainable procurement, and reducing our own emissions of greenhouse gases and pollutants. Prioritising disease prevention, health promotion and public health services is it's very cost effective, as well as probably increasing sustainability. Engaging the health workforce, we have a huge health workforce as agents of sustainability is very important as well, and that's an area probably we can keep working on. Increasing community resilience and promoting our local assets and creating incentive for change. Some of those areas are areas in which probably we need to be doing more in the health sector, but we have a guidance out there which is probably beneficial for us to use. We feel we have lots of potential health co-benefits. It's already mentioned, all these decreased respiratory disease, diarrheal diseases, obesity, cardiovascular disease, diabetes, cancers and complications of all of these, and then the pressure on services. And we feel the case for mitigation isn't just about, getting fined by Europe or whatever, or just a Paris Agreement. It's actually, we feel that there are health grounds that we need to be pushing for, people recognising the fact that this is not, we can't go on like this on health grounds as well. But we do want people, I feel anyway, and I think personally feel, but I think most of my colleagues would feel the same as well, that we need to protect the well-being of the people in the sectors affected. We need to look after them as well. So we need to incentivise and support them and not put intolerable burdens, because of course they will affect people's mental health as well if they're not able to manage. So the challenges are really balancing all these interdependencies, and we can't work alone. We do work currently in silos more so, though we all have sectoral focuses, and health is not necessarily a priority for other sectors. So it's trying to get that health onto other sectors' agendas is important for us anyway. Of course, we need other people to see the benefits of health from their sectors, and I'm not sure that I haven't seen anybody really mentioning that a healthy workforce and a healthy population is in everybody's interest. Climate epidemiology is an area in which we have a big challenge, because a lot of our data, health data, isn't collected with any weather variables. Few diagnoses are associated with a direct weather cause like sunstroke or whatever. A lot of them they've got multiple attributions. And so far it hasn't been identified as a priority. But I think it's very important though, because the lack of climate epidemiology information may result in costly maladaptation. If we haven't got the health data to provide to the other sectors, we may end up allowing them to make mistakes almost with the use of resources. So it's important that we try and get ourselves geared up as well, especially for big funding into the future. But the opportunities, again, are the same as really the challenges in some ways. We have these interdependencies, and we all rely on each other. So this is my last slide, actually. Anyway, we all rely on each other. So it's a real opportunity for us. We have to communicate with each other. We have to influence each other. For us to be successful, we can't operate in silos anymore. We've got to work with each other. It might take a bit of a while before we all start speaking in the same language and speaking about the same things, and all recognising that each other's goals are our goals as well. If as long as we're all going for the same thing, the political decision making, I'm not sure. I think that's something, again, maybe we all need to persuade our politicians to try and aim for common goals. There's an opportunity, I think, to design out inequalities. There's such a fundamental change in lots of areas in society that perhaps we have opportunities to go back and redesign some of the way we do things, to not be just changing by increments, but actually, make bigger changes and design in safer, fairer, better health and societal systems. And maybe design out wasteful activities, understand where the waste is coming from. Maybe we try to just design it out better. I think a lot of there are good examples of those already today, but it's everywhere we operate. And integrated planning is required in every way, I think, mitigation and adaptation. And something that health sector always wants is health in all policies. And I feel it's the first time I've felt really in working in public health that actually there is an opportunity for us to influence health in all policies, because I think we are seen as a sector there that has to be incorporated, and so it's up to us in a way to try and provide that, or in the health sector to try and provide the information required to help the other sectors to take on board the health issues as well. And that's it. Thank you.